Hi everyone, my name is Abigail Chesterton, and this is my Global Health Inquiry Comparison presentation. This semester I studied the United Kingdom, and today's presentation is going to compare the United Kingdom health system to that of the United States. A bit of background on the healthcare system in the United Kingdom. It is better known as the National Health Service, which was born out of the National Health Service Act of 1946. The NHS, or National Health Service, provides free healthcare services to all permanent residents of the UK, which is a total of about 68 million people. The NHS is considered the largest healthcare system in the world, and it works to provide healthcare based on an individual's need, not on their ability to pay for services at the point of service. The first point of comparison between the UK and the United States will be the provision of healthcare services. The government in the UK owns all of the hospitals and other providers of NHS care, including ambulance services, mental health services, district nursing, and other community services. All providers of healthcare in the UK are registered with the Care Quality Commission, and this allows the tracking of performance according to national standards. Along with owning the hospitals and other healthcare providers, most doctors are also employed by the National Health Service. And according to the Newfield Trust in 2021, there were approximately 2.95 doctors per 1,000 people living in the United Kingdom. In the United States, quite differently, healthcare facilities are primarily owned by private sector businesses. According to the Kaiser Family Foundation, there were about 18% of hospitals that were community hospitals that were run by state or local governments in 2022. In the United States, about 70% of doctors are employed by health systems, private equity firms, or insurers themselves. So only about 3 in 10 doctors work in independent practices. In 2019, there were about 2.8 doctors per 1,000 people, and interestingly enough, these providers were most commonly concentrated in the northeast section of the United States. Next, we're going to compare cost of healthcare in the United Kingdom to that in the United States. In the UK, they spend approximately 10% of their gross domestic product on healthcare expenditures, and in 2022, their total GDP was approximately $2.9 trillion. At the point of service or the point of need in the UK, healthcare coverage is free. So individuals do not have to worry about being able to afford their healthcare when they receive it. The majority of the UK health system is funded through taxation, either through individual taxation or taxing of companies, and approximately 18% of a citizen's income tax is allocated for healthcare services. In the United States, approximately 18.3% of gross domestic product is spent on healthcare expenditures. And in 2022, total GDP was estimated at $25.46 trillion. So the United States is spending drastically more money on healthcare. That was a total spending of about $4.3 trillion, and that's estimated to be about $13,000 per person in the United States. At the point of service, cost varies fairly significantly. The biggest impactors of cost are whether or not an individual has health insurance. Someone who is uninsured would be expected to pay significantly more than someone who carries insurance, but cost of healthcare really varies based on an individual's insurance coverage. Healthcare training varies slightly between the two countries. However, both countries do involve a significant amount of additional education and training beyond just a basic advanced degree. In the United Kingdom, medical doctors begin with a degree in medicine from a participating medical school, and this initial training lasts typically 4 to 7 years. It is followed up by a 2-year foundation program, which is where someone receives general medical training and also receives training with different specialties. In the participants' second year of the foundation program, they elect a specialization, and then at this point, this is when they begin to collect a salary. For their specialty training, they will receive additional years of training. If someone's going to be a general practitioner, they'll generally train for an additional 3 years. For more specialty trainings, they will receive up to 5 to 8 years or more for given specialties. It can be up to 10 years for someone who is training in pediatrics. All told, healthcare training in the United Kingdom can last anywhere from 9 to 17 years. In the United States, medical doctors begin with an undergraduate degree, and this can be from whatever school an individual chooses to attend. They then enroll in 4-year medical school, at the end of which they select a residency to complete more specialized training. Typically, providers will spend anywhere from 3 to 7 years in residency, during which time they will apply for medical licensure at the end of said residency. Depending on an individual's subspecialty, they may be required to go on through additional training through what's known as a fellowship program. And typically, a fellowship includes research time as well as ongoing training and wraps up with a completion of a board certification. In total, the undergraduate degree, medical school, and residency lasts anywhere from 11 to 15 years of additional training. However, if an individual does go on to receive a fellowship, they would spend even more time during their healthcare training. Next, we'll compare health outcomes in the United States versus the United Kingdom. In the United Kingdom, there are approximately 3.8 deaths per 1,000 live births, whereas the United States experiences 5.4 deaths per 1,000 live births. And in the United Kingdom also, life expectancy is longer, with an average of 81.3 years, whereas the United States is 76.1 years. Women in both countries experience a longer life expectancy than men, with the United Kingdom experiencing 83 years for women, while men are at 80 years. And in the United States, women experience a life expectancy of 79 years compared to men at 73 years. So despite the significantly higher spending on healthcare in the United States, individuals both experience lower life expectancy and there is a higher infant mortality rate. I chose to select and compare vaccination rates for COVID-19 between the two countries, and looking at the number of doses administered, in the United Kingdom, there were 151 million doses administered as of September of 2022, whereas in the United States, there were 662 million doses administered as of February 2023. I think some of this discrepancy or difference can be attributed to the varying levels of population in both countries. So I elected to take it one step further and look at percentages of individuals in each country that have been vaccinated. So as of October 2022 in the United Kingdom, just under 70% of individuals have gotten one dose. About 65% of individuals are fully vaccinated, meaning 2 doses. And then about 52% of citizens in the United Kingdom had gotten at least one booster vaccine. In the United States, there were higher rates of vaccination. There were approximately 76% of individuals who had gotten at least one dose of COVID vaccine, and about just under 74% of individuals were fully vaccinated. And then about 57% of individuals had gotten at least one COVID-19 booster. So we're seeing a higher rate of COVID vaccine acceptance in the United States. The two countries experience somewhat similar leading causes of death when compared to each other. So in the United Kingdom, 2021 and 2022, the top 5 causes of death were dementia and Alzheimer's disease, ischemic heart diseases, cancers of the trachea, bronchus, and lungs, cerebrovascular diseases, and chronic lower respiratory infections. In the United States, for the same time frame, heart disease was considered the number 1 killer, with cancer at number 2. COVID-19 was 3, followed by accidents, so unintentional death at 4, with cerebrovascular diseases in the number 5 spot. The final comparison between the two countries that I elected was the threats to the healthcare system. While they were somewhat similar threats, the United Kingdom had a slightly different third threat that I addressed, which I'll discuss here a bit further. In the United Kingdom, they are struggling with government funding not matching the demand for healthcare services. And according to Warner and Zarenko, this largely has to do with effects of inflation. So although healthcare spending allocations have risen, they are not matching the rates of inflation. In the UK, they also experience workforce shortages. So in 2021 and 2022, there were vacancy rates, and in comparison, there was a 7.9% vacancy rate in NHS medical and nursing positions in 2021, whereas in 2022, that rate rose to 9.7%. Unique to the United Kingdom that the United States has not necessarily experienced is a lack of electronic medical records. And unfortunately, this is a major threat to the healthcare system, especially when considering cost of care and the government funding issues, because lack of medical records, electronic sharing of information is very difficult, which has led to duplication in services and medical tests, which can increase wait times for those tests and procedures, and therefore increasing the cost of the healthcare due to these duplicated services. In the United States, the cost of the healthcare system is also an extremely large issue. According to Pearl, the healthcare in the United States is the most expensive and least effective healthcare in the world. The United States also experiences nursing shortages, and there are increasing rates of individuals' plans to report to leave the workforce or move out of patient care. According to Montero and colleagues, about 40% of U.S. adults report delaying or foregoing medical care in the last year due to cost. And older adults tend to report more difficulty affording healthcare services, especially those that Medicare doesn't cover, like hearing services, dental care, and prescription medications. About 25% of U.S. adults report that they or a family member have foregone a prescription or taken other cost-saving efforts like cutting pills or skipping doses in order to make their medications last longer. And 1 in 3 insured adults even report concerns of affording their monthly premium, while 44% report worrying about being able to afford their deductible. Finally, there's been a lot of COVID-19 burnout and quote-unquote moral injury, according to Pearl. Providers have been faced with pain and difficulty coping with being unable to provide excellent medical care throughout the COVID-19 pandemic. And physicians are increasingly turning to alternative employment opportunities outside of patient care, like working for insurers and private equity firms. Staffing shortages and this burnout also have led to more baby boomers retiring, increasing patient demand from either COVID-19 itself or simply an aging population, and staff shortages lead to additional staff burnout, moral injury, surgical delays, and cancellations. And all of these things can lead to worsening patient outcomes. So the United Kingdom and the United States both are currently struggling with those shortages of staffing and difficulty with the cost of healthcare, and would be able to take or would have to take different approaches to solving said issue. Finally, these last few slides are my references.